Medicare can feel overwhelming, like someone handed you a toolbox full of pieces without instructions. That's why we're here. In this video, we'll give you a clear, no-fluff breakdown of what Medicare is, how it works, what it covers, and what it doesn't. Medicare is a federal health insurance program. It's designed for people 65 and older, but also covers some younger people with certain disabilities or medications. Think of Medicare as a set of tools to manage your health care. Each part plays a different role. Part A covers your hospital-related care, inpatient stays, skilled nursing facilities, hospice, and some home health care. For most people, there's no premium. Part B covers your outpatient care, doctor visits, lab work, preventative screenings, and equipment like walkers or wheelchairs. It comes with a monthly premium, which for most people in 2025 is around $185 monthly. Parts A and B don't cover dental, vision, hearing aids, or most prescription drugs. They also won't help if you're traveling outside the US or need long-term care. That's why many people add other tools to their Medicare kit. Part C, also called Medicare Advantage, is an all-in-one plan from a private insurer. It includes Parts A, B, usually Part D, and may add extras like dental, vision, or gym memberships. It may have low or $0 premiums, but you must use that plan's network of doctors and hospitals. Part D helps cover prescription drugs. These plans vary based on what drugs you take and what pharmacy you use. Medigap, also known as Medicare Supplement Insurance, helps cover the out-of-pocket costs that original Medicare doesn't, like deductibles, coinsurance, and copays. It only works with original Medicare, not Advantage plans, and comes with its own premium, but it gives you predictable costs and more freedom to choose providers. You've got two main paths. 1. Stick with original Medicare, Parts A and B, then add Part D and maybe a Medigap plan. Option 2. Choose a Medicare Advantage plan, Part C, that bundles it all together. Your initial enrollment period is a 7-month window, 3 months before your 65th birthday, your birthday month, and 3 months after. Miss it and you could face lifetime penalties. Delay Part B without other coverage? You'll pay 10% more for every year you waited. Skip Part D? You'll pay an extra 1% per month added to your premium for life. Medicare isn't a one-size-fits-all. The right plan depends on your doctors, your prescriptions, where you live, and how much you want to spend. A few smart choices now could save you a lot later. Want help finding a plan? Visit Medicare Help Hub for free tools, guides, and real human help. Like, comment, and subscribe for weekly Medicare videos made simple.